Hello, Mrs. Humphreys. How are you doing today?
I'm good. How are you?
Good too. Well, my name is Viri, and we met before this morning. I am your nursing student, and I just wanted to come in here and say that we already took your vitals, and then we checked your blood glucose, and it looks like you will be needing some insulin. So we're gonna go ahead and get that prepared for you, as well as your morning meds. And I already performed hand hygiene as well before coming into your room, just so you are aware of that. So I'm gonna go ahead and I'm gonna go draw up those meds for you, okay? And I'll do some education as well.
Okay, thank you.
Alrighty. So I am in the med room and I'm looking at the MAR, and it looks like we have insulin MPH 10 units sub-Q injection twice daily at 8 and 2000. Then insulin Lispro 2 units subcutaneous twice a day with breakfast, lunch, dinner. Give the morning dose at 7:30 per client request. So it is exactly that time, and it'd be best if we combine those two. So I'll be giving a total of 12 units. It looks like she also has ceftriaxone, 0.5 grams intramuscular every 12 hours for a UTI. And according to my calculations, she will be administered 1.4 in the ventrogluteal site. And then we have cyanocobalamin, which is her B12 injection, IM, once a month, and I'll be going in the deltoid. So I'm gonna go ahead and I'm just verifying that this is the right patient, right med, right time, right route, right indication, and then right documentation once I document. And this is for Miss Thelma Humphreys, date of birth 9/13/1937, and there is no known allergies as well. So I'm gonna go ahead and I'm gonna start with my insulin. I'm gonna go ahead and sanitize my hands before I begin. I'm gonna go ahead and sanitize my vials, 15 to 10 seconds. Okay. Alrighty. Then before I even draw, I'm just gonna mix it just to make sure everything's mixed. It looks like it is, but I want to make sure. And go ahead and sanitize it again. Okay, so I have my insulin needle, a new insulin needle. I'm verbalizing is a new one. And it looks like I'm gonna draw up a total of 12 units right now for this combination of insulin. I'm gonna go ahead, go into my cloudy solution, and put in 10 of air. Then I'm gonna go ahead and go into my short-acting, push in 2, and take out 2. Alrighty, then I'll go back to my cloudy and I'll take the rest of the 10, which will make the 12. And I'm gonna do this very slowly because I can't mix or put back in this medication. And I'm gonna do 12 units. Alrighty, I'm gonna make sure I capture safely. I'm gonna have my secondary nurse verify that this is 12 units.
Yes, that is correct.
Alrighty, I'm gonna go ahead and I'm gonna produce a label for this. Insulin, NPH, and Lispro, 12 units. Name and initial, date. I'm gonna go ahead and label it. And then because this is drawn up already, I'm gonna make sure that this is verified with the MAR. This is for Thelma Humphreys, and it is 12 units in total for her insulin. So this is the right patient, right time, right route, right documentation, right indication, and right dose as well. I'm gonna put this over here. I'm gonna sanitize my hands one more time. I'm gonna move on to the ampule, which is her vitamin B12 medication, which will be in the deltoid, and I will be drawing up 0.8 milligrams. I'm going to sanitize my hands. I'm going to go ahead and pop the ampule, and I'm going to go ahead and use a clean needle And then I'm gonna go ahead and use a filter needle to withdraw. And it looks like it is 2 milligrams in this ampule. So I'll be disposing of the rest and I'll have a nurse verify. I'm gonna go ahead and draw up 8. Let me try that again. Alrighty, I'm gonna go ahead and cap this, change it, make sure that I verify that with my nurse, and I'm taking out bubbles.
Yes, that is correct.
Okay, I'm gonna use a new needle. I'm gonna go ahead and screw it on, and then I'm gonna make sure that this is the 0.8 milligrams that will be going to Miss Thelma Humphreys, and it is for the right patient, right med, right time, right route, right indication, and documentation. I'm gonna go ahead and I'm gonna label it as well. I'm gonna leave that on the side. Sanitize my hands, and then I'm gonna have a nurse verify that I'm disposing of the rest of this medication on her med disposal. I'll leave it right there. Alrighty. Now I'm gonna move on to my Cefotriaxone, which is for her UTI. Sanitize my hands. I'm gonna look at the medication. I'm gonna look at the MAR. I'm gonna verify that this is for the right patient, for Miss Thelma Humphreys. And then same thing with my ampule. I verified that it was for Miss Humphreys, but I'll do the same with this medication as well. And it looks like I will need to reconstitute, so I will take a look at the vial. I'll take a look at the vial, and it says I need 2.1 milliliters of sterile water to reconstitute. So I will go ahead and I will get that prepared. So I'm gonna go ahead and sanitize my hands. And this is for the right patient, right med, right time, right route, right indication, right documentation, and right time. Go ahead and pop these vials open, and I'm gonna simulate that they weren't open. Scrub vigorously. I touched this one. Let me try that again. And then this will be a new, I'm verbalizing this is a new one. Okay, so I'm gonna go ahead and I'm gonna grab a needle. And I'm gonna take out 2.1, but I'm gonna use this one instead. And then this is clean. No, just kidding. I'm gonna use this one because it's 2.1 to reconstitute, and to administer we're doing 1.4. Alrighty, I'm gonna go ahead and remove this. Then I will withdraw the air, introduce it into the vial, draw up the correct amount. This is 2.1. I'm gonna go ahead and I would change needles. Then I would go ahead and penetrate this, and then I would reconstitute. I would withdraw, cap, safety cap, dispose of this, and then I will go ahead and mix this. And while I'm doing this, I'm also one more time verifying this is for Thelma Humphreys. Date of birth 9/13/1937. This is the right med, right route, right patient, right indication, right time, and right documentation. And I'm gonna go ahead and just continue mixing until all of it has been mixed. Alrighty, then using a new needle that is in a sterile packaging, I would, in an ideal situation, this needle would come in a sterile package, so I'm going to simulate that. I'm going to go ahead and have that measured out, the 1.4. Go ahead and draw up the 1.4 for her. Okay, then I would make sure to recap this safely. Then I would have a nurse just making sure to verify that this is that 1.4. So I have the 1.4 prepared, verifying this for Thelma Humphreys, right for the right patient, right time, right dose, right medication, right indication, and right patient, and right documentation. And this is the ceftriaxone, which will be via ventrogluteal. I will make a label for that. Okay, I'm gonna make sure to have that done. And once more before I leave the MAR, this in an ideal situation, this would be cleaned up and disposed of properly. But I'm verifying that this is for Miss Thelma Humphreys. We have insulin, we have a B12 injection, and we have a ceftriaxone. This is for the right patient. This is the right med, right time, right route, right indication, and right documentation. So I'm gonna go ahead and I would take these with me to Mrs. Thelma for administration. Alrighty. Hi, Mrs. Thelma, this is Beery.
Hi, Mary.
Hi, we are back with our medications and I am ready to give those to you. How does that sound? Are you prepared?
I am.
Okay, I'm gonna go ahead and I'm gonna sanitize my hands. While I'm doing that, I'm checking on the MAR that I do have the correct medications. I have a B12 injection, which is 0.8 milligrams that I will be giving to you on your deltoid. Insulin 12 units that I will be giving to you on your belly area, and ceftriaxone that will be given in your ventrogluteal area. And you are Mrs. Thelma Humphreys. I'm going to check that with your wristband, and I will have you tell me your name and date of birth as well.
Thelma Humphreys on 10/25/1980.
Okay, awesome. I think you meant 1987, right?
Yes.
Okay, awesome. Alrighty, and everything seems right. I'm gonna go ahead and sanitize my hands one more time. I'm gonna apply some gloves. Alrighty, Mrs. Thelma, do you have a preference on where to start?
No, not really.
All right, okay, so we're just going to go ahead and we're gonna start with your insulin first. So with your insulin, you may feel some itching, and then you might feel like you have to go to the bathroom. You might feel some diarrhea come up, but that is completely normal. But if you feel like like you feel like you have chest pain, or you feel like you can't breathe, you will let me know, okay?
Okay.
Okay, so I'm gonna go ahead and I'm gonna expose your stomach, and I'm gonna go 2 inches away from the umbilicus. I'm gonna go ahead and pick my site, sanitize, and this is dry. I'm gonna go ahead and get a piece of gauze, hold it between my third and fourth finger. I'm gonna go ahead and before I administer, I'm gonna ask for your name and date of birth again.
Thelma Humphreys, 10/25/1987.
Alrighty, awesome, and I'm gonna check her wristband again. And that is correct, okay. I'm gonna grab a new piece of gauze. I'm gonna go ahead and I'm gonna get this all prepared. Alrighty, so I'm gonna go ahead and I'm gonna pinch it, and I'm gonna go in your belly, okay?
Okay.
Ready? 1, 2, 3. Sorry, now I'm gonna just go slow. I'm gonna safety cap it. I'm gonna put a piece of gauze for 10 to 15 seconds until the bleeding stops. How are you feeling, Miss Thelma?
Oh, it wasn't that bad.
Okay, awesome, sounds good. Alrighty, are you ready to move on?
Yes.
Okay, I'm gonna change my gloves, and I'm gonna sanitize my hands. And we're gonna do our deltoid, which is our vitamin B12 injection. So that's gonna go right over here on your arm.
Okay.
And for the vitamin B12 injection, you might feel a headache or slight dizziness, but you let me know if that is beyond your discomfort. Like if you're feeling chest pain again, or if you feel you can't breathe or you can't see, you will just let me know, okay?
Sounds good.
Okay, and I'm verifying that this is according to the MAR. This is for Miss Thelma Humphreys, so this is right patient, right route, right medication, right dose, right indication, and right documentation. I'm gonna go ahead and I'll have you verify your name and your date of birth, and I will be looking at a wristband one more time.
Thelma Humphreys, 10/25/1987.
Perfect, thank you so much, Miss Thelma. So I'm gonna go ahead and I'm gonna look at your arm. So ideally, I would go 3 fingers down from the acromion process right over here, and I would inject that right there. But for simulation purposes, I'm gonna do it right over here. I'm gonna go ahead and I'm gonna sanitize the area until it's dry. And it is dry. I'm gonna go ahead and get this prepared for her. Alrighty. And this is your vitamin B12, okay? I'm just gonna stretch out the skin taut. Okay, 1, 2, 3. Okay, awesome. I'm gonna gauge my safety in this needle and then dispose of it in the sharps. I will grab a gauze and I will hold it in place until it stops bleeding for 10 to 15 seconds. Alrighty, how are you feeling, Miss Thelma?
Pretty good.
Perfect. Alrighty, now onto our final medication. We have our cefatriaxone, and this one I will tell you, it is going to hurt, and this is gonna go right in your gluteus area, okay?
Okay.
Don't be alarmed, everything. I'm gonna measure the site where I'm gonna be doing that injection to you, and I'm just going to demonstrate that for you. So that'll be, if this was in a real person, not a mannequin, I would go ahead and I would put my hand on the greater trochanter, my fingers pointing towards the iliac crest, and my thumb pointing towards the groin. So ideally, I would administer the injection right here. Alrighty. Did you understand my instructions, Miss Thelma?
I did.
Okay, so I'll just have you lay towards your left side, and I will prepare everything. So I'm gonna go ahead, I'm gonna go at the MAR again, and while I'm doing that, I'm gonna sanitize my hands, and it looks like this is for Miss Thelma Humphreys. This is the right med, right time, right route, right patient, right indication, and right documentation. And before I administer, Miss Thelma, can you give me your name and date of birth again? And I'm gonna look at her wristband one more time.
Thelma Humphreys, 10/25/1987.
Awesome. All right. Let me grab a swab of alcohol wipe. Gonna clean that area. And it's dry. And I'm simulating that this is using the same wipe. I'm gonna clean one more time, but a clean one using a new alcohol wipe. I'm gonna go ahead and recreate the same process. I would give it right here. So I'm gonna leave that alcohol wipe right there until it dries. Then I'm gonna prepare my medication. Alrighty. Alrighty, Miss Thelma. Are you ready?
Yep.
Okay. 1, 2, 3. Alrighty, we're all done. Get a gauze, hold it in for 15 to 10 seconds until the bleeding stops. And we're all done, and I would dispose of these needles. Go ahead and take my gloves off. How are you doing, Miss Thelma? Are you feeling any different?
No, I feel okay, thank you.
Okay, well, I want to just let you know one more time that with this last med, you may feel some headache or dizziness, and you might have some bruising in the area, but do not be alarmed. That is completely normal with this medication, but if you feel short of breath, like you can't see, or you're having chest pain, just let me know, okay?
Okay.
Okay, I'm going to go ahead and I'm going to sanitize my hands. I'm going to reposition the patient. Alrighty, Miss Selma, here is your call light. You just let us know if you need anything, okay?
Okay.
And then I will go document my medications. Thank you, Mrs. Selma.
Thank you.